There's no doubt you've heard about changes to the healthcare system and how we get healthcare when we need it, but it can also be confusing to some. We asked folks from the Health and Welfare and Your Health Idaho to help sort this all out for us. From Health and Welfare, down at the end, we have Deputy Administrators Greg Kunz and Lori Wolf, and from Your Health Idaho, we have Amy Dowd. And for, I guess, transparency's sake, I would like to say that Greg Kunz is my dad. Thank you all for being here. Let's go ahead and start with the first question. And Greg, let me ask you this, and that is to define the difference between health and welfare and the Medicaid system versus what you can get with the online health exchange, known as Your Health Idaho.
I think the simple way to describe that is that the Affordable Care Act created the opportunity to access health care for anyone between 0 and 400% of the federal poverty level. And for those people in that range, they could receive a subsidy or receive Medicaid. So there's a standard method now for determining eligibility for that health care coverage. And Medicaid covers the lower end of that spectrum. And the insurance coverage is available to those at the higher ends of that income spectrum.
And a lot of that has to do with the amount of people in your family. So let's talk about that family. We have a family of, let's say, 4 people who would fall into that Medicaid. Lori would have probably kids, because that's what Medicaid really focuses on, is disabilities and children.
Right. The Idaho Medicaid program really does focus on coverage for children, elderly, and disabled. But let's take your example, the family of 4. In Idaho, most often it's the kids who are going to be eligible because our income limits for the adult population is so low. If we have a family at, say, 100% of the federal poverty limit, it's likely their children are going to be eligible for Medicaid, but the parents would not be. And in that situation, we would enroll the kids in Medicaid, and then we would send the adults or the parents over to Your Health Idaho, and they could be enrolled in insurance and receive a subsidy to help pay for that insurance.
Here in the state of Idaho, Amy, with Your Health Idaho, we've been using kind of the federal system where you're underway right now trying to be prepared to take over the reins. When is that going to happen? Are you guys prepared?
Yeah, well, we're working very fast and furiously to make that transition. We are on target to open our doors for the next open enrollment period for our exchange, and bringing in a lot of expertise to assist us to be successful on that journey.
In fact, if you remember from last year, the Federal Health Exchange kind of had some problems, particularly with the amount of bandwidth they had, so the websites kept crashing. Are we going to experience any of that from the state-based exchange?
There are a lot of lessons to be learned from the state-based exchanges that were ahead of Idaho. We are looking at those lessons learned and making sure that we're putting procedures in place to have appropriate testing. And we're bringing in, as I mentioned, a lot of expertise to ensure that there is a smooth opening and a launch to our exchange.
Let's just stick it with you, Amy, for just a second. And let me just ask this. How difficult is it for people to get online and enroll, and using kind of the underpinnings of there? You've had a lot of success. We're ranked 2nd in the nation per capita of people who are signing up for health insurance. We are. We're
very pleased with the most recent figures that have come out, ranking us 2nd per capita in our enrollment. And it is. The process has improved significantly. There's a lot of assistance for people available. We have a great partnership between Your Health Idaho and our agent and broker community. We have a call center that assists people to find resources to help them with choose their options. We also have in-person assisters that are available across the state, ready to help people come in, sit down, have a face-to-face one-on-one conversation about their family and their situation and what options might be available to them through Your Health Idaho.
You know, let me switch back over to Medicaid and the kind of this variance between the two, Your Health Idaho and the Medicaid system, and that is what we've heard a lot about this gap, people who fall in between whether they qualify for Medicaid and whether they can get assistance through Your Health Idaho. How realistic is this gap, and who's going to fall into that, Greg?
Well, Idaho's Medicaid program, and this comes back to the Supreme Court decision, the Supreme Court said states have options for expanding Medicaid. So in Idaho's situation, our Medicaid program is very simple, and the levels of eligibility are very low. So there are individuals who will fall above what Medicaid will cover, and where the health insurance exchange begins to provide a subsidy for health care coverage through a private insurance plan.
How does that, and we've heard this term a lot, MAGI. Lori, can you explain for us, first of all, what MAGI is and how this plays into Medicaid?
You bet. I do think there has been some confusion because we toss around MAGI. And I'll start with just talking about what does MAGI stand for. MAGI is the modified adjusted gross income, is what the term MAGI stands for. However, it's much more than just a number on somebody's tax form. MAGI is really a methodology for how we determine who's eligible, and it takes into consideration how we count income, who's counted in the household, whether or not resources are excluded. And the reason that's a critical part is because MAGI is a common factor, eligibility factor, that both the department will use to determine Medicaid eligibility and your Health Idaho will use to determine if someone's eligible for a subsidy.
We've heard a lot about the expansion of Medicaid and the fact that we may not get any kind of expansion through the legislature this year. But we've also heard of this word reform. Just real briefly, and I don't know who best to call on for this, but what does reform do and how is it different from doing just a Medicaid expansion program?
Well, I think, you know, the decision to expand in any state is obviously an important decision because it does expand the Medicaid program, it will cover more people, and it will come at a cost to taxpayers. So Idaho is trying to be mindful about when or whether or not to expand. And I think the first step that the state has chosen is to look at the Medicaid program and make sure that we're able to have a successful Medicaid program. Reform comes in the way of making it more efficient and more effective, trying to manage costs, so that when we do choose, if we choose to expand Medicaid, it'll be more affordable and more sustainable in the long run.
If somebody out there falls into this gap, they know that they make too much to qualify for Medicaid, but they don't quite make enough to afford health insurance from the exchange. What kind of recourse do they have? Are they just out there on their own, or are there ways that they can get help? Greg?
Well, there are clinics and hospitals that do provide services. We know this is a common situation, or I should say we hear about those situations where someone does not have sustained coverage, either in insurance or through Medicaid. And it is a more piecemeal kind of approach where someone is responding to a particular medical incident and getting services or getting support or getting help when they need it from a hospital, an emergency room, or a free clinic.
I imagine you get this question a lot because a lot of people are out there shopping. They're trying to find the best deal that they can get. What do you encourage them to do at that point?
Well, as far as those who fall into the gap, I mean, we refer them to resources that are available through the state, through the 211 line, and then if the person is eligible for the subsidy, we might refer them to an agent or broker to help them further refine their decision and understand their options. Or we would have an in-person assister, sitting with them, walking them through, helping them understand what are the real costs. Insurance can be very complex and it's very unique to each individual's situation. So it is important to have the right resources available when you're making those very important choices.
Are there people who are unsure about what kind of assistance they can get and have to ask this question? And how easy, because if we see things online, like we've been hearing a lot about, there's still that comfort in hearing a human voice in all this.
There is, and this is a whole new thing. It's a whole new way of shopping for insurance, right? You're able to compare side by side a number of plans. You're able to access a subsidy if you are determined eligible, and because it's so new, there are a lot of questions, and that's very natural, which is why Your Health Idaho has been working very closely with Health and Welfare and other community partners to make those types of resources and information available to individuals so that they do have all of the information they need to make the best decision for them.
We've actually heard in past years, did you have something to
I was just going to add something because I do think as we talk about that gap, most of those individuals are going to be between 0 and 100% of poverty. And one thing I think that doesn't get talked about a lot when we talk about the Affordable Care Act is there are new requirements for employers as well. So individuals who, I think from the department standpoint, we may serve those individuals through our food stamp program or through cash assistance program. And one of the things that we really strive to do is to get them into an employment and training program and help get them access to the workforce. I mean, that's kind of our long-term goal. And then at that level, employers are also required to help provide affordable insurance for those individuals, and especially for those adults. So that is another avenue that I don't think gets discussed as much, but for now is something that we're focusing more on the Department of Health and Welfare, putting resources into our employment and training program and helping those individuals get access to job training, resume writing, things that will help them get employed.
I had a lot of questions from people who are disabled, and they're wondering, you know, we still want to be productive citizens, but if I get a job, suddenly I no longer qualify for all the assistance that I need to live through Medicaid. Is there a way that they can still work as in a part-time job, low-paying jobs usually, and still feel somewhat productive and yet still be able to get the things they need?
Yes. And it is important to note that Medicaid for individuals who are disabled is different for able-bodied individuals. So there are Medicaid options for individuals who do have a disability. And for those individuals who are working, still having, you know, even though it's low wages or they're working part-time, still have access to some of those services to help support them in the workforce as they get more sustainable employment.
Greg, we're running out of time, but I just wanted to ask this question. How do you see health and welfare changing over the next 10 years? How is the system going to be looking in 10 years from now?
Well, that's an interesting question. I think we've had a bold experiment at the federal level at automated processes and how well people can interact with an automated system and a web system. I think the Department of Health and Welfare believes strongly that people seek understanding and they want to know what they're getting into. They want to understand the requirements and their responsibilities. So we've really focused on trying to help people gain access to knowledge and make choices. And I think we will find that there will be more automated systems. There will be, I'm hoping, much more effective ways in which programs can be administered. I think the costs are always a concern, and costs are something we want to keep down. So it's how effectively can we manage these programs, and then how effectively can we distribute them to those who are in need, and as Lori said, making sure that we provide an opportunity for people to better themselves, find employment, get some training, because I don't think anyone really wants to be on assistance and that type of support. They want to be on their own. So I'm hoping the department plays a very strong role in helping individuals find what they can do and how they can do it and reach their potential.
We had some question whether Medicaid was sustainable. The last, in 2009, 2010, we saw the people who are qualifying for Medicaid really start to expand considerably. This year we actually saw it kind of level out, but is it sustainable in 10 years from now?
Well, that's a really good question. I don't know the answer to that. I think our responsibility today is to do those things that make sense for us. And I think that's why people are very thoughtful and very cautious about how do we make this system something that isn't going to be a runaway, that it's accountable, that people are understanding the benefits and the services that are available, and that they're used wisely and appropriately, because we cannot afford a system that is not efficient and effective in its distribution.
And Amy, I'll leave the last question with you, giving that 10-year down the road. How do you see Your Health Idaho in 10 years from now?
Well, certainly that's a long horizon. I think that we can anticipate a lot of change in the healthcare marketplace. We certainly anticipate that there will be continued interest in Your Health Idaho and accessing a wide variety of plans on the marketplace. And our goal is to make sure, similar with the health and welfare and the Medicaid system, is that we have a very sustainable model that's going to meet the unique healthcare needs of Idahoans.
All right. Thank you all for coming in. We're going to have to leave it there.
Thank you.